Hi everyone, I'm Jackie from Chronically Jackie. I know this is a long video, but please bear with me and watch these first 2 minutes because I'm going to give out some important information. I have a lot of chronic illnesses, this we know, but I'm not just randomly plagued with them. I'm this way for a reason. My medical team has discovered a lot of genetic anomalies that are very likely the explanation for all of my medical conditions. One in particular is a gene PrEP mutation. It greatly impacts the systems that I have difficulty with: neurologic, gastric, and immunologic. So my symptoms originate from my genetic mutations, and my symptoms just so happen to fit the diagnostic criteria for all my chronic illnesses. It's important that I get diagnosed with my chronic illnesses so we can form specific treatment plans in order to better my quality of life. Since I have genetic-based disorders, I get a question very often. It is, why didn't you have problems as a child? Well, I did have problems as a child. I had a number of medical issues growing up, and as I grew older, they became worse and worse. And when I hit puberty, that was the driving factor, and my medical team agrees, that threw all of my medical issues into overdrive. That's when I became symptomatic enough to start receiving diagnosis after diagnosis. I also get asked, why does no one in your family have the same issues as you if this is genetic? Well, the way Mayo Clinic and my geneticist explained it to me is that I am either a mutation, meaning that the genetic mutations begin with me, or my family members are carriers and don't present with symptoms, and I'm the one that presents with symptoms. Now, this video is kind of boring. I am so sorry to say that. If you want the everyday up and down adventures of living life with multiple chronic illnesses and a service dog, you want to watch my vlogs. But if you're new to my vlogs, or you just want to learn more about my chronic illnesses, you're in the perfect place, because all I'm going to do is sit here, talk to the camera, look off to the side every once in a while to look at my notes, and give y'all all the information I have to offer on my chronic illnesses. One thing I do want to say right now is there is a difference between a disability and a chronic illness. Just because I have a chronic illness does not automatically make it a disability. A chronic illness is a long-lasting medical condition. Often it is lifelong and without a cure. And a disability is a medical condition that greatly and substantially limits one or more major life activity. An example of a major life activity includes showering, walking, and providing basic needs to yourself. Some of my chronic illnesses greatly impair the examples I listed and other major life activities on a daily basis. I'm not going to specifically say which of my chronic illnesses are disabilities at the moment, because what is a disability now may not be a disability in the future, and vice versa. If you want to know how my chronic illnesses are affecting me right now, you can go visit my vlog upload playlist, because I give very specific updates on how I'm doing with my chronic illnesses right there. In the description is a table of contents. If you're looking for a specific chronic illness, it'll tell you exactly what time that chronic illness starts, and you can go straight to it. You don't have to watch the entire video. There's also a ton of helpful links in the description. If I happen to show you something like a VOG mask I wear to filter allergens or germs, you'll most likely be able to find a link to it in the description of this video. Keep in mind that how chronic illnesses affect me can change, and I may get a new diagnosis. Also, chronic illnesses affect everybody differently, and these are my personal experiences, which may differ from yours or for somebody you know. I'm going to do my best to proceed in a timeline fashion, starting with my first diagnosis and ending with my most recent diagnosis. Some of my diagnoses do overlap each other, but I'm going to do my best to stick to that timeline fashion. There are some things I won't discuss in this video, and that is specific medication names. I'm just not comfortable making some of that information so public. If I happen to mention something like I take a medication at night to regulate my sleep, but I don't mention the medication name, it's just because I'm not comfortable sharing it. There are a few exceptions to which medications I will share, and if I'm comfortable with it, I'll tell you the name of what I'm taking. I'm not going to discuss my port or my infusions in this video, but there's links to those videos in the description. And now that that's all out of the way, let's get started. Narcolepsy is a neurological sleep disorder, and it was my first chronic illness diagnosis. It began in middle school when I had a lot of difficulty staying awake in class, but it wasn't just there. Movie theaters, social functions, hanging out with friends, I literally began sleeping my life away. But what actually led us to my first sleep study was my erratic sleepwalking that started around age 14 or 15, where I would actually leave the house. And don't worry, I take medication at night so I don't sleepwalk anymore, but back then it was a problem. So I did that first sleep study and they found signs of narcolepsy in my sleeping patterns. So then I did several other sleeping studies and MSLTs, which are multiple sleep latency tests, daytime nap studies, and I got a confirmed diagnosis of narcolepsy with cataplexy at age 15. Basically, my body is constantly trying to shut down for sleep. I was sleeping 18 plus hours a day, and that is like ridiculous, okay? This is because I have non-restorative sleep due to a fractured sleep cycle, so when I go to sleep, my brain never really has a chance to recharge. Studies have shown that the average narcoleptic is functioning as if we have gone 72 hours without sleeping. Talk about sleep deprivation, the cognitive effects that come with that, like brain fog and memory issues, is ridiculous. I used to have these sleep attacks where I would literally fall asleep. I could be talking to someone, sitting, eating, walking even, and I would just fall to the floor. No warning. Yes, I would get hurt from that sometimes. And thankfully now I have a better treatment, and my sleep attacks, is what they're called, have changed as I've grown and the disorder has progressed with me. Now I feel it coming a few minutes ahead of time, and it's this irresistible urge to go to sleep, and I have to lay on the floor no matter where I am and just give in. Sometimes it's been weird places like the floor of the grocery store, but now that I'm on a good treatment, I get a good enough warning that I can like make it to the couch or a normal place, and they're very, very far and few and in between, so I'm really thankful for that. Back when I was first diagnosed, no, I couldn't drive, plus I was still having seizures and whatnot, so anyways, I also have type 1, which is with cataplexy, and let me explain this. Your brain releases a hormone to paralyze your body when you dream, so you don't act out your dreams. This is supposed to happen, but when you have cataplexy, this goes off at inappropriate times during the day, and it's usually triggered by strong emotion, like laughter and surprise and excitement. Laughter is my biggest trigger, and I become paralyzed but remain fully aware and conscious. It's weird. It can be something as simple as your knees buckling, your hands giving out, or a full body collapse. And before I got into good treatment, I was having more than 20 full body collapses a day. And yeah, I could get injuries from this, and it's really unsettling to have something go so wrong with your body, yet you can't communicate with anybody. So you're just laying there on the floor, everyone's freaking out, you can hear everything, but you can't communicate. And for me, they would only last about a few minutes, but I know people who they've lasted a few hours, and sometimes it's just a few seconds. So it varies from person to person, and it varies from cataplexy attack to cataplexy attack. Now with my good treatment, it's usually just my knees will buckle if I'm having a really hard laughing fit, or if I get really startled, my legs might give out. So anyways, sleep paralysis is another symptom, and that's happens when you're coming into sleep or you're coming out of sleep, and it has to do with that same paralyzing hormone, and that's where you're fully aware but you just can't move your body. And this actually happens to a lot of people, not just narcoleptics, and it can be really scary and it can feel like an eternity, but I promise you it only lasts a few minutes and it's not going to hurt you. And some people even hallucinate with their sleep paralysis, and I use air quotes because they're not hallucinations, they're your dreams entering your sleep paralysis state. And just because you have sleep paralysis does not mean you have narcolepsy, but it is a common symptom of narcolepsy. But again, a lot of people get this. So anyways, now I'm doing much better. I take a medication at night to regulate my sleep cycle. I tried stimulants, but because I had POTS at the time and we didn't know, they made me feel terrible. So I couldn't tolerate them because of my POTS. It would make my heart rate increase, because that's a side effect of stimulants, tachycardia. If you watch my POTS section, you'll understand what I'm talking about. So now I can only take that one medication at night to regulate my sleep cycle. It's only specifically for narcolepsy, and it's greatly improved my life a lot. And a lot of people don't understand that narcolepsy just goes beyond being tired. There's a lot of other symptoms with it, and it can be debilitating like it was for me when I was first diagnosed. I still struggle with my narcolepsy sometimes, and it's still not easy. It's still a constant battle to stay awake, but because I found an effective treatment and good doctors, I'm doing better. Epilepsy is a neurological disorder in which nerve cell activity in the brain is disturbed, resulting in seizures. This is my second diagnosis, and I was diagnosed around 15 or 16 years old. My first seizure occurred when I was helping my church clean out a soup kitchen, and it must have been heat triggered because I was outside in the sun moving around crates when I fell to the floor. It was not like any of my narcolepsy episodes I was still currently having at the time, because I started convulsing and repeatedly hitting my head against the floor. I sustained a concussion, I puked on myself, I was unconscious, and I think I peed myself too, because Sometimes when you have a seizure, you can lose bladder and bowel control. I don't remember any of this. My family told me all this when I finally came to. When I stopped convulsing, I didn't wake up, so they took me to the hospital. I underwent a lot of MRIs, which is imaging. Mine was of my brain, all normal except for one spot in my right hemisphere, which I'll go over in my migraine section. And then I went through a lot of EEGs, which are electrodes they put on your head with glue that takes forever to get out. And then they look for electrical activity in your brain. And no, you don't have to shave your head for those. I obviously like my long hair. However, my family and I were so confused because mine all kept coming back normal and clean, no seizure activity. Yet I was still having these horrible seizures, getting concussions, hurting myself, biting my tongue off, not off, but like seriously damaging my tongue while having seizures. So they decided, the doctors decided to put me on seizure medication regardless of the EEG results. And they did help. I did stop having seizures once we found the right combo, but my family and I were concerned because anti-epileptic drugs are very strong and can be potentially dangerous. So why are we putting me on these drugs when my EEGs don't show seizures? So we went to Mayo Clinic in Jacksonville to confirm this diagnosis, and they were so helpful. Through specialized testing, a special MRI, and a few other things I don't exactly remember because it happened a few years ago, they were able to determine that my seizures originate from very far deep within my left hemisphere. And the reason traditional EEGs that just rest on the scalp can't pick it up is because they're too far in deep, too deep within my brain. Now, they could have done an intracranial EEG, but that involves shaving some of my head, drilling holes in my skull, and then placing a needle electrode into my brain to find the right spot. Very invasive, and they didn't want to do that on me since I was already responding so well to medication. They changed up my medication and gave me one that worked so well and I didn't have any side effects from it. And as of January 4th, 2017, I've been seizure-free for 2 years, which is awesome. Mayo was also extremely helpful in determining what type of seizures I have. They found out I had tonic-clonic seizures, in which that's what you typically imagine seizures to be, the big convulsions that are violent. That's the ones where I would puke and I would sometimes lose bladder and bowel control. And those would take me days to recover from because they're so brutal on my body. Sometimes I would lose days worth of memory, and those were just the worst, in my opinion, for me to go through. Then I would have complex partials in which maybe one limb would tense or I would repeat the same phrase over and over again. Those didn't take me so long to recover from. And then I would have absence seizures in which I would just stare off and then pick up right where I left off. And I didn't even know I would have those. So Mayo was very helpful, and like I said, I've been 2 years seizure-free, but even though I've been 2 years seizure-free, I'm still affected by my epilepsy because it's so much more than just seizures. I have sustained permanent balance issues from the concussions I've gotten from my seizures, and I have permanent moderate to severe memory impairments due to my epilepsy that will always be with me no matter how long I'm seizure-free. And then there's always the chance that I could have another seizure and my seizures could come back. So even though I'm seizure-free for a long period of time, and I'm always praying for my fellow epilepsy warriors, I will always be a proud epilepsy warrior. Migraines are the most common neurological disorder in America. I've technically had migraines since middle school because they did occur back then, but they were so infrequent. It wasn't until I was diagnosed around age 15 or 16 that they began increasing in frequency to 2 to 3 times a week and 3 to 4 times a week at my worst. Migraines have to be occurring 15 days or more out of a month to be considered chronic, like mine were. They are diagnosed clinically, so that means by your doctor's observations and also your symptoms. Plus they have to rule all other possible causes out. I've actually gotten a spot of scar tissue on the right side of my brain due to my migraines. That's how intense they can get. They can cause scar tissue on your brain. Mine was found by an MRI. And my migraines are right-sided. It's just, you know, the typical throbbing, relentless pain. Sometimes it's a stabbing pain, and I'll get eye pressure with it, and usually light sensitivity, sometimes noise, depending on how severe it grows. Usually when I get a migraine, I lay in bed with the lights off and the TV on very, very low, just to distract me from the pain if at all possible. And I do have an abortive medication, but finally I found a regimen that has brought my frequency in migraines down to 2 to 3 times a month. I have a prescription medication after going through several prescription medications trying to find one that worked. We found one. And also, I really attribute my success to something called CoQ10. It's a supplement. I get a big bottle of it at Target. It's the best bargain because it's kind of pricey, and I take 600 milligrams a day. It's done wonders for my migraines. We found out that my Ehlers-Danlos syndrome is the cause of my migraines, and I'll get more into that in my Ehlers-Danlos syndrome section. And the biggest thing, migraines are not just a headache. They are so much more than that. A lot of people don't realize that chronic migraines are actually a form of chronic pain, and they can be debilitating. So keep that in mind. Also, migraines affect everybody differently. Like, my friend has vestibular migraines, and she doesn't always get the pain, but she's very off balance because of it. So there's some info on migraines. Asthma is a condition in which a person's airways become inflamed, narrowed, they swell, and they produce a lot of extra mucus, making it really difficult to breathe. Most people grow out of asthma, while I grew into it. Actually, it's not that uncommon for adults to develop asthma. I did not have it whatsoever as a child, but at age 18, I began having enough breathing difficulty to warrant a PFT, a pulmonary function test. My pulmonologist put me in this clear box, and I sat down and breathed in and out of this tube doing different breathing exercises the tech asked me to do to test my lung function, and they could barely even register my at-rest breathing. It was not good. So at age 18, my pulmonologist diagnosed me with asthma. I have cough variant asthma, so I don't wheeze, but instead I have these crazy coughing fits for my asthma attacks. My biggest triggers are cigar and cigarette smoke, humidity, and overexerting myself. I have a rescue inhaler, of course, for my acute attacks, but I also take prescription medications and pills, and I do several breathing treatments every day with my nebulizer. And, sometimes I feel like an elephant is sitting on my chest. Other times my chest feels really tight. Sometimes I feel like my lungs are on fire. And a lot of the time I just have a really hard time catching my breath. I feel very short of breath. So, asthma is not just a childhood disease. It can affect anyone at any age. IBS, or irritable bowel syndrome, is a digestive disorder that causes a lot of abdominal pain and can alternate between diarrhea and constipation. I know that's kind of gross. You do not have to watch this section. I am predominantly diarrhea, and when I first began getting sick with this around 18 or 19 years old, I lost a lot of weight. I was 5'3", 18 or 19 years old, initially 120 pounds, and I dropped all the way to 98 pounds. It was bad. So I went to Mayo Clinic in Jacksonville, and they helped figure out what was wrong because nobody could tell me why I was sick. No one would think to say, oh, it's IBS. And it's a clinical diagnosis, so on a doctor's observations, a patient's symptoms, and excluding all other possible causes. That's what they did. Diagnosed me with IBS when I was 19 years old, and thankfully I finally came out of that initial flare, and now I'm doing much better with it. I only take a magnesium supplement for it, I think about 500 milligrams a day to help me stay regular, and like my gastroparesis, my IBS tends to come and go with my gastroparesis in flares, and I'm nowhere near as bad when I first developed it, so I'd say I'm doing much better with my IBS. CVS, or cyclic vomiting syndrome, is an increasingly recognized disorder in which it's highly suspected that the gut-brain connection just doesn't work well. Patients present with episodes of relentless, violent vomiting and nausea that can last from a few hours to several weeks. CVS affects every patient differently. You can have calendar kids in which their episodes happen at specific times and intervals, like 3 a.m. every 6 weeks. Or you can have triggers in which something triggers them. Mine were always triggered. I wasn't a calendar kid. My main triggers were heat and stress, though they could happen at random too. And they always happen early in the morning, like 3 a.m. Anyways, the last one I had was April of 2016 when I had my wisdom teeth taken out. Imagine relentlessly puking, not being able to take your pain meds from the surgery, and then puking right where you had your wisdom teeth taken out. It was bad. Had to go to the ER for that one. But that was not the last episode I've had since now in 2017, and I highly attribute my remission to a supplement called CoQ10. CoQ10 helps people with mitochondrial disease. I have mitochondrial disease. CVS has been linked to mitochondrial disease. That's why it's suspected that CoQ10 greatly helps people with CVS. Won't help everyone with CVS, but it's helped me, and for that I'm thankful. I take about 600 milligrams a day. So before I found out about CoQ10 and I was still having episodes, I'd have 1 to 2 a month. Some I could manage at home, some I had to go to the ER, and I would just puke and puke and puke. They'd last for about a week. and I'd become very, very dangerously dehydrated and my electrolytes would get out of whack. That's when I'd go to the ER and they would abort or stop the episode with IV fluids and IV Zofran. Now that I have a port, I can give myself my own IV Zofran, an anti-nausea med, and IV fluids. If you want to learn more about this, check out the links in the description of this video. So this is a diagnosis of exclusion, and it's diagnosed clinically, meaning on a doctor's observations of patient's symptoms and ruling out all other possible causes for the episodes. You have to find a knowledgeable doctor because not many doctors know about this at all. For me, I had to go all the way up to Mayo Clinic in Jacksonville to get a diagnosis because, like I said, not many people or doctors know about it at all. And when I was around 19 years old, Mayo Clinic diagnosed me with CVS, and since then I've been doing a heck of a lot better thanks to CoQ10. Autism is a developmental disorder, and I also have a sensory processing disorder that goes along with it. I was diagnosed with this at 20 years old in adulthood at Mayo Clinic through a series of extensive neuropsych testing and a very thorough evaluation. I don't see this as a chronic illness, but rather it's a part of who I am that could use a little guidance at times, but it also gives me a set of strengths. I actually have a video that I already made that goes into detail about my autism and sensory processing disorder, and you can find a link to it in the description of this video. Mitochondria are in every cell of your body, and they are responsible for energy production. Mitochondria have their own DNA, which you get from your mother, but no, my mom isn't sick like I am, neither is my dad. I'm kind of the only one in my family who's like this. So anyways, Mayo Clinic unraveled my entire genetic code, including my mitochondrial DNA, and found a few interesting things. I'm only the second person in the world to have this type of mitochondrial mutation, and usually a mitochondrial mutation is heterozygous, meaning some are affected, but mine is homozygous, meaning all my mitochondria are affected. And we don't know how much it's affecting me though, so they took a skin biopsy and sent it to a lab, but insurance, of course, is holding us up, and they were gonna run testing on the skin biopsy to see just how much this mitochondrial disease is affecting me. Now, mitochondrial disease is not curable, and really the only treatment is a mitococktail of different vitamins, and I take CoQ10. And that I already take for my cyclic vomiting syndrome and migraines, and high doses of CoQ10 is the #1 recommended treatment at Mayo Clinic for mitochondrial disease. So I'm kind of already doing everything I can. It's not curable, but it would be nice to have answers. That's what we learned at Mayo, and like I said, hopefully insurance will give in and allow the testing to be done on the skin biopsy, and we can get even more answers. Ehlers-Danlos syndrome, or EDS, is a connective tissue disease in which my body cannot properly produce collagen. There are many variations of EDS, and I have type 3, which is hypermobility type. Collagen is the most abundant protein in your body, and it holds you together like glue. Without it, everything is loose and stretchy, and it causes a slew of problems. EDS is genetic, and I've had it my entire life. Lifelong symptoms include joint pain, delayed healing of cuts and scrapes, and things like that became progressively worse as I grew older. Even though I've had it my entire life, I wasn't diagnosed until I was 20 years old. It does tend to run in families, and my mom seems to have some very mild symptoms of EDS, but not enough for a diagnosis. So maybe I got it from her, or seeing as it's genetic, I could also be a mutation that it started with me. Type 3 is a clinical diagnosis, meaning there's no specific genetic testing or blood work or medical test to confirm, yes, you have it. It's based on a doctor's observations, a patient's symptoms, and ruling out all other possible causes for the patient's symptoms. I had no idea what EDS was when I was diagnosed, even though I had briefly heard it mentioned here and there in the chronic illness community. I was diagnosed when I went to Mayo Clinic to see a neurologist, who also happened to be a hypermobility specialist. He evaluated every single one of my joints and found that they move far beyond where they should. He gave me a test called a Baton test, and I scored an 8 out of 9. One thing they use to test on the Baton test is to see if your thumb can touch your arm, like this. Mine can on both arms. Just because you can do that does not mean you have EDS, but it's something they use in the diagnostic criteria. There's other things he had me do that I won't show y'all because you're not really supposed to hyperextend your joints because it causes damage each time. But beyond the Baton test, he also did more to evaluate my joints and found that I was extremely hypermobile And being a hypermobility specialist, he felt confident in diagnosing me with Ehlers-Danlos syndrome type 3. Symptoms include really sharp pains in my joints, stabbing joint pains, joint popping, frequent misalignments, and even occasional dislocations. My ribs frequently dislocate, my hips have subluxed, which is partially dislocate, a handful of times, and the top vertebrae in my neck are constantly slipping out of place. Yes, it is painful, and no, I don't go to the emergency room for these dislocations because I can usually get them back into place. Obviously, if I couldn't get my joints back into place, I would go to the ER or my doctor. EDS is not just joint issues. It goes far beyond that. Because the joints are negatively affected, the ligaments and tendons and surrounding muscles and nerves are also negatively affected. My joints pinch down on my nerves and cause numbness and tingling throughout my body. The muscles are very tense because they're overstretched from the joints moving too far from where they should. So I have a lot of muscular pain in relation to joint pain as well. I've had tendonitis several times as well because imagine the tendons are being stretched way too far from where they should be. I have a lot of chronic pain due to my EDS. I don't take prescription painkillers just because it's not a good option for me, seeing as I also have gastroparesis and that would delay stomach emptying even more. And I personally don't want to rely on prescription painkillers. Some people do use prescription painkillers in their treatment and it's a good option for them, but it's just not a good option for me. So to treat my chronic pain, and yes, I always have some type of pain going on due to my EDS, I take over-the-counter painkillers as needed, even though they don't really touch my pain. I use a heating pad, and rest helps, but honestly, the only thing I can really do is just deal with my pain. At one point, my pain had gotten so bad that I felt unconscious from it and I had to go to the hospital. So that is how severe pain from EDS can become. EDS is actually the cause of my migraines. Because my neck gives me so many problems and it's so hypermobile and the vertebrae slip out of place, it causes tension and that just shoots up and causes my migraines. So it's nice to know the cause of my migraines. I also have something called cervicogenic dizziness because of my EDS. My neck is hypermobile and pinches down and sends incorrect signals to my inner ear, and that's the balance center of your body. And so in addition to the lightheaded dizziness I get from my POTS, I also get feeling like I'm on a boat that's rocking and vertigo from the cervicogenic dizziness from my EDS when my neck is acting up. EDS can affect so much more than just joints. As I mentioned, it affects my nerves, causing numbness and tingling, my muscles, it can affect digestive issues and malabsorption, it can cause delayed healing of cuts and scrapes and injuries, and so Ehlers-Danlos syndrome can affect a wide variety of things in a whole body systemic way. So because everything is loose and stretchy, it also greatly affects my POTS, postural orthostatic tachycardia syndrome, and I will talk about that more in the next section. POTS, or postural orthostatic tachycardia syndrome, is a form of dysautonomia or autonomic nervous system dysfunction. Your autonomic nervous system, or ANS, is responsible for things you don't even think about, like breathing, blood flow, blood pressure, and heart rate. So imagine if those things didn't work properly. It's not fun. My EDS, or Ehlers-Danlos syndrome, which I spoke about in the previous section, highly contributes to my POTS because it makes everything loose and stretchy, including my blood vessels. My ANS attempts to help with the upward flow of blood against gravity by contracting blood vessels. But due to my EDS, this is very difficult because those blood vessels are loose and stretchy. Since my ANS cannot contract my blood vessels properly, blood tends to pool in the wrong places. For me personally, my blood always tends to pool in my lower extremities, and sometimes you can even see my legs turning purple from blood pooling, and yes, it can be pretty painful sometimes. This means my blood flow isn't regulated because it's pooling, and so my ANS makes my heart beat very quickly to compensate, and that's the tachycardia aspect in POTS. Diagnostic criteria has to do with heart rate increase upon standing, and your heart rate should remain between 60 and 100 beats per minute whenever you change positions. That is healthy. But mine can go from 90 beats per minute sitting or laying down, and as soon as I stand up, it'll shoot to 170 beats per minute. And no, it doesn't matter how slowly you get up, you're still gonna have the symptoms. And sometimes my resting heart rate is also high. This creates a slew of symptoms: dizziness, weakness, shortness of breath, chest pain. Let's see what else. Fainting, syncope, which is fainting, blood pooling, which can be painful, and a lot of fatigue because our bodies are working so hard and our hearts are beating so fast just to regulate our blood flow. Studies have actually shown that people with POTS are expending energy as if they're always running in place. One of my biggest POTS issues besides fatigue and dizziness is heat intolerance, because when you become hot, your body naturally dilates your blood vessels. You're already loose and stretchy blood vessels that your ANS can't contract properly, so it's even harder for your ANS to contract them. And so my threshold temperature is about 76, 77 degrees Fahrenheit, and if I go outside in a temperature more than that for more than a few minutes, I will pass out. And it becomes an emergency situation because my heart cannot pump blood to my vital organs, and I usually always have to go to the hospital for heat-related syncope. It's not fun, but they've always, obviously, I'm still here, it's fine. How I got diagnosed with POTS is I've actually had it since I was 15 years old, but I was having seizures back then, and we contributed my fainting spells to drop seizures. But then I reached a period of seizure-free, and I'm really thankful for that. And I was still having the fainting spells, and I just knew something wasn't right with my body. Something was off. And so we went to Mayo Clinic for a few other things, and I mentioned my fainting and dizziness to them, so they set up a tilt table test. That's how you diagnose POTS and a few other forms of dysautonomia, because there's lots of different types of dysautonomia. And that's where they lay you on a table and then bring you upright, and you're strapped in. It's not like claustrophobic or anything, but just in case you faint so you don't fall on your face. And they monitor blood pressure and heart rate and maybe a few other things. It's not painful at all. And they found that I had the diagnostic criteria of the heart rate increase, and I just wanted to be, I do this a lot. I go to other specialists to confirm diagnoses that they give me because I want to be sure I have this condition before I go around and treat myself for it, because the treatment is taking medications that alter blood pressure and heart rate. And I was like, okay, I'm 20 years old, that's a little extreme. So I went to 3 other doctors who knew about POTS, and one of them is my current POTS specialist who's very knowledgeable about POTS. They all said, yes, you definitely have POTS. And so I was like, all right, let's start the treatment. And now I take a combination of oral medications, one to keep my blood pressure up too, because I have issues with my blood pressure dipping very low sometimes, and I also do lactated ringers and saline infusions 3 times a week through my port. If you're interested in learning more about my infusions and my port, I have links to those videos in the description of this video. And they don't fix everything. I still struggle a lot with my POTS, but thanks to having a good doctor, which took me a long time to find, the search for a good doctor is hard, I'm doing much better and my quality of life has improved. Gastroparesis is a condition that causes delayed stomach emptying due to a partially paralyzed stomach. It comes with a slew of digestive symptoms such as heartburn, bloating, pain when eating, nausea and vomiting, weight loss, the inability to eat much of anything, getting full after a few bites, lack of appetite or no appetite, weight loss, malnutrition, malabsorption of foods and nutrients. Some people also have issues with their blood sugars because of gastroparesis. It can affect things like having too much diarrhea or constipation. It affects a wide variety of things, and it's mostly a symptom of digestive issues. And it affects everybody differently. Some people with GP are so severe in their symptoms that they require a feeding tube and cannot eat orally at all. Other people with GP can still eat orally but have difficulty. However, some people with a feeding tube still eat orally as well. They do oral intake and supplemental nutrition through a tube for their intake. Just because you have a feeding tube doesn't mean you can't eat orally. I've had digestive issues my entire life, but it was never enough for a diagnosis until I saw a new GI doctor at the end of 2016. She said my daily symptoms of heartburn, nausea, frequent vomiting, weight loss, not being able to eat much of anything, all of those were just very concerning to her. And I thought those were all due to my cyclic vomiting syndrome, but she suspected gastroparesis, especially since gastroparesis often went with other diagnoses I already had, like Ehlers-Danlos syndrome and POTS. So she ordered a gastric emptying study. That is the most frequently used test to test for gastroparesis. And basically, you go in the morning and eat a portion of radioactive food, and you don't taste the radioactive component, but in my opinion, the hardest part about the test is keeping the food down because you're already having issues with eating. So I had eggs, milk, and toast. I had to eat everything, but I just couldn't. And they said, that's fine, do your best. And then every hour for 4 hours, they take a picture of your stomach with an x-ray to see how quickly or slowly the food moves through your stomach. I had a gastric emptying study done in 2014, and the first half was delayed emptying. The second half was normal, so there was no diagnosis. But this one at the end of 2016 showed delayed emptying. It wasn't extremely severe, but it was enough to cause issues. I have daily issues with my gastroparesis. Nausea is the biggest one, pain when eating, bloating, and I always struggle to keep weight on, even when I'm not in a flare. I do tend to get flares with my gastroparesis. They come out of nowhere and they last a few weeks. And I know I'm in a flare because I can't eat solid foods or I have an extremely difficult time eating. And one of my worst flares happened a few weeks after I had my gastric emptying study in 2016 to confirm the diagnosis. I could not eat any solid foods. I was surviving on liquid things only, like smoothies and Ensure, and I dropped more than 25 pounds. I was very malnourished, very weak. It was scary, and I almost needed a feeding tube to get supplemental nutrition. I was so close to getting a feeding tube, but for some reason, I also at that time started my IV hydration therapy for my POTS, and for some reason that treatment also helped my gastroparesis and helped me come out of that flare. So even when I'm not in a flare though, I do still have some daily symptoms with my gastroparesis. It is a constant battle, but I'm thankful for the times I'm not in a flare, and when I'm in that flare, I just do the best I can, and that is all about my gastroparesis. Median arcuate ligament syndrome is also called celiac artery compression syndrome, and basically what happens, the median arcuate ligament in your abdomen compresses the celiac artery and restricts blood flow, which leads to a slew of digestive issues, the biggest one being pain when eating. It can also cause bloating, lack of appetite, weight loss. Some people are so severe with their mouths that they have to get a feeding tube in order to sustain themselves. This was found by a sonogram with exhalation, meaning that I'd have to exhale, hold it, then they take the picture with the sonogram. That's apparently how you have to do it in order to get proper results. My POTS doctor is the one who ordered the sonogram because apparently this often goes with POTS. I'd never even heard of median arcuate ligament syndrome until my POTS doctor mentioned it to me. This is the only condition I have that is considered curable. But the only thing is that I'd have to have an out-of-state surgery with a knowledgeable median arcuate ligament syndrome surgeon to get it done. And that's kind of like a lot for me to handle right now with my health. It just doesn't seem very feasible. My POTS doctor said the longer I wait, the more scar tissue will accumulate and the worse it'll become. But he said we seem to have caught my median arcuate ligament syndrome very early, which is why I'm not very symptomatic with it. And so since I'm managing pretty well, we're not rushing for surgery because like I said, an out-of-state surgery would be a lot for me right now, especially with how crazy my health is. So we're keeping the surgery in mind for sure, but it's not a pressing matter right now because we seem to have caught the mals in me very early. It hasn't progressed to a very severe state, even though I have more than a 70% stenosis constriction of my celiac artery. My symptoms are not very severe. Anyways, that is all about my median arcuate ligament syndrome. December 27th of 2016, my health took a turn for the worst. In the afternoon, I was having allergy skin prick testing. It was an environmental panel that showed I was highly allergic to basically everything in nature. The only thing I didn't react to was dogs. By that night, I was having my first angioedema attack. Angioedema is the rapid swelling of tissues, and my attacks often occur in my throat. Following that initial attack, I was hospitalized for 9 days because I had back-to-back relentless angioedema attacks. Throat swelling shut, my oxygen stats dropping dangerously low, running through epinephrine like crazy. Within the span of 4 months, I had been hospitalized more than 30 days and had gone through more than 30 doses of epinephrine. Since then, the attacks have never stopped happening. I wasn't diagnosed with angioedema until March 13th of 2017, so at first we thought my attacks were actually anaphylaxis. Angioedema is on the spectrum of allergic reactions, so we weren't totally far off. For a while, I was diagnosed with idiopathic anaphylaxis, which is anaphylaxis with no known origin. We were also looking into mast cell activation disorder, and I was later diagnosed with that as well, and I'll talk about that more in my mast cell section. When an attack happens, my first signs are bright red rashes on my arms and chest. Depending on how severe the attack becomes, the rash can spread to my stomach and legs and back and other areas of my body. My face becomes red as well sometimes, especially around my eyes. Coughing follows as breathing becomes more difficult and my throat begins to swell shut. My oxygen stats drop as well. They should stay between 95 and 100%, but mine has gone as low as into the 70s in severe attacks. Each attack is different from one another. No attack will be the same. Some are not as severe and some are really severe. It just varies from attack to attack. As I mentioned, angioedema is on the spectrum of allergic reactions. It's a severe one at that. Allergies can trigger angioedema attacks, but we're having a really difficult time pinpointing my specific triggers. What we do know is that my angioedema stems from my immune system. I have severe immunodysfunction. Some parts of my immune system are really deficient and other parts are hyperactive. In your blood, there is something called complement levels, and your immune system uses them to regulate water moving through tissue or osmosis. When the complement levels are off, osmosis isn't done correctly and swelling occurs. It's the hyperactive part of my immunodysfunction that causes my body to metabolize a certain complement very quickly. That complement is C1q. This leads to sporadic swelling of my tissues, which is the angioedema attacks. My attacks most frequently occur in my throat, which would be considered internal swelling. Sometimes I also have external swelling, and it's most usually seen in my eyes and in my face. But most of my attacks, like I said, are internal swelling happening in my throat. So why did I just start having angioedema attacks at the end of December in 2016? I've never had any previous to that. Well, the way my geneticist explained it to me is that our immune systems are always changing. And remember, my severe immunodysfunction is why I have angioedema. He said that the immune system we are born with is not the one we have now. He compared it to the way that people may not be born with allergies, but they can develop allergies later in life. So the immune system I had at the time of the allergy skin prick testing in December of 2016 was already having major problems. And the skin prick testing acted as a major catalyst because I was just exposed to way too many of my severe allergens at once that set off the first angioedema attack, and from there I continued to have them. Although I tested positive to environmental allergies, it's really difficult to know if they are currently triggering my angioedema attacks. The skin prick testing was an exception because I literally had several of my severe allergens embedded under my skin. Grass, pollen, trees, basically everything in nature turned out to be a severe allergen, and it was a shock to my system. That's why it triggered that initial angioedema attack. Now it's hard to know for sure if my allergens I tested positive for are triggering me because there's no apparent pattern with my attacks, and an attack can happen hours upon hours after exposure to an allergen. For example, I could go outside and, say, touch the grass or breathe in some pollen that I'm allergic to. I could react right away, an hour later, or even that night. But what's to say the exposure caused my reaction? Because the next day I could do the very same thing in regards to the exposure and have no attacks at all. Like I said, there is no apparent pattern with my angioedema attacks whatsoever. But just to be safe, I wear something called a VOG mask when I'm out of the house at all times. It just goes on like this, and it filters allergens in the hopes of preventing as many angioedema attacks as possible. It also helps with my immunodeficiency. We're also having a hard time identifying food triggers. Like I said, there's no apparent pattern with my angioedema attacks whatsoever. I could eat something and have an attack that day, and the next day I could eat the same exact thing I ate and have no attacks whatsoever. So it's been really difficult. The only thing we've been able to identify as a trigger to my attacks is cigar and cigarette smoke. If I'm exposed to that for a long period of time, I'll most likely have an attack. But like I said, other than that, no apparent pattern whatsoever. There are many types of angioedema. Although we know I'm deficient in the complement level C1q, that only tells us that I have angioedema. It doesn't tell us the type. In order to know the type I have, my doctor needs to see specific patterns in my blood work, and that just hasn't occurred yet. My doctor said it's very difficult to figure out the type of angioedema a person has, and he says we may never know the type I have, but that won't stop us from trying to figure it out. He says it's most likely not hereditary angioedema, but rather a C1 acquired type. We do know for a fact that it's my immunodysfunction that is causing my low complement level. Since we do not know the type of angioedema I have, I'm not a candidate for the specific treatment of angioedema, which is complement replacement therapy. That's basically giving my body the complement that it burns through too quickly. I'm not a candidate for this option because insurance will only approve this treatment if they know the specific type of angioedema I have, and we are just not there yet. And that is because it's ridiculously expensive and insurance wants to know all the details before they approve it. Yes, we do know that I'm deficient in the complement C1q, but remember, that only tells us that I have angioedema. It doesn't tell us the type of angioedema, but I'm not out of options just yet. We still have treatment options for my angioedema. During an acute attack, we will put IV Benadryl through my port. If the IV Benadryl doesn't work to abort or stop the attack, then we will use an EpiPen. The thing about the EpiPen is I have to go to the emergency room after each use. But with IV Benadryl, if this aborts the episode, we don't have to go to the ER. That's why we always prefer to use IV Benadryl over an EpiPen. This is my emergency medication kit. It has all we need inside it to abort my angioedema attacks and to have refills and things like that. It is always very close to me. It's not as simple as just putting IV Benadryl through my port. There's a specific order of saline, IV Benadryl, another saline, and then a heparin. Every single flush requires its own alcohol swab before hooking it up because everything needs to stay nice and clean and sterile. Imagine when I'm in an attack. I'm itching like mad. My throat is slowly closing. I'm coughing. I'm struggling to breathe. I'm trying not to panic, which is hard when you're struggling to breathe. And my oxygen is dropping, so I'm losing sensation in my fingertips. So fiddling with all of this stuff, remembering the order, remembering sterile protocol can be very difficult. In a slow-moving attack, I'm able to administer my own rescue meds. But in a quickly progressing attack that's very severe, I am not able to administer my own IV Benadryl. That's why we try and have somebody with me at all times. But in all honesty, that's just not practical. But it's okay for me to be alone because I can always give myself an EpiPen no matter what. Because while this is a huge process, an EpiPen is just take the top off and boom, right into my leg. Then I call 911, go to the emergency room, alert my loved ones, and all is, maybe not all is good, but I'm alive and that's the most important thing. So that is how we treat the acute attacks. As for more of a preventative measure, I'm on something called IVIG, intravenous immunoglobulin. It's a blood plasma product and it takes about 20,000 donors to make a single dose. Because it's a blood plasma product, it has complement levels in the IVIG. It won't be as effective as the complement replacement therapy I mentioned earlier, but we're hoping that I'll get at least some relief from my angioedema attacks because I'll be getting at least some of the complement that I burned through too quickly, that's C1q. The IVIG is also going to be treating the main root cause of my angioedema, my severe immunodysfunction. And now I'll talk about my immunodysfunction in the next section. I have severe immunodysfunction and it's giving me quite a bit of problems. Just to clarify, this is not autoimmune in which the body attacks itself, but rather it's just my immune system not working properly. Through extensive blood work, we found that my immune system has some very hyperactive parts and some very deficient parts. At first this confused me, but then my geneticist explained that immune systems are kind of like the military. You have the Army that does some things, the Air Force that does some things, the Marines, the Navy, and then there's some overlap between them. So when he explained it that way, it made sense to me that some parts could be working too much and some parts could be deficient. As for my deficiency, all of my immunoglobulin markers are very low. IgA, IgM, and IgG are all extremely below where they should be. And I have something called panhypogammaglobulinemia, meaning I barely make any antibodies whatsoever. Antibodies act as like a ball and chain to the bad guys or the bad germs. They slow bad germs down and mark them as invaders so your immune system knows who to attack. Since I barely make any antibodies, the bad germs that get inside me are not slowed down and they're not marked as bad invaders, so my immune system doesn't know to attack them. It's a big problem. My low immunoglobulin markers and my panhypogammaglobulinemia are the immunodeficiency aspects of my immunodysfunction. It leaves me vulnerable to viruses, infections, sicknesses, things like that. It's why I catch pretty much anything that goes around and why anything that I catch becomes very severe for me. Why I'm always on antibiotics, and why it takes me forever to get over anything. As a precaution, I wear a VOG mask when I leave the house. It goes on like this, And it was recommended to me by my doctors because it helps to filter germs. It won't filter every germ, but it adds an additional barrier and an extra step of precaution. It doesn't hurt to wear it. I also did a test called an immune cell function test through blood work. The normal range is 500 and below, but I scored a 694. This is the hyperactive part of my immune system. Similar and more specialized blood testing showed very similar results. Basically, whenever my immune system becomes activated, it is very hyperactive, so it freaks out. This causes frequent fevers, fatigue, and a general feeling of being unwell. The hyperactive parts of my immune system are also responsible for my angioedema and mast cell activation disorder. My doctor said my immunodysfunction is also likely causing systemic inflammation throughout my body, which leads to neuromuscular issues such as numbness and tingling, muscular weakness, muscular pain, and so on. So between my Ehlers-Danlos syndrome and the systemic inflammation from my immunodysfunction, I'm having quite a bit of issues with neuromuscular symptoms. Due to the severity of my immunodysfunction, my doctor told me it was imperative that I got a bone marrow biopsy done. It was also important that I had one done due to one of my gene mutations. My gene PrEP mutation has a great potential to negatively affect bone marrow production. So we were very relieved to find out that my results were overall very good. I have no issues in the type of cells I produce or the number of cells I produce. We already knew that my issue lies within cellular function due to previous blood work testing. The bone marrow biopsy also confirmed that we were doing the right thing for treatment. My immunodysfunction is not curable, but it is treatable with something called IVIG, intravenous immunoglobulin. It is a blood plasma product and takes about 20,000 donors to make a single dose. Basically, you take healthy immunoglobulins from healthy donors and give it to my faulty immune system. So you're basically giving my immune system what it needs to regulate itself more efficiently and become stronger. Since my immunodysfunction is the root cause of my angioedema, my mast cell activation disorder, and some neuromuscular issues, we're hoping that with IVIG helping my immune system, we're also going to see some relief in those areas too. My immunodysfunction is so widespread and severe, my geneticist estimates that I'm going to need a higher than average dose of IVIG, and I will also need it very frequently. But we're going to start slow and increase my frequency and dosage as I can tolerate. It's really difficult to know if I've had this immunodysfunction my entire life. My geneticist said our immune systems are constantly changing to adapt to new environments, exposures, allergens, germs, and so on. The immune system we're born with is not the one we have now. And since I was never tested for immunodysfunction until 2017, it's even more difficult to know. But I will say I do remember always having issues getting sick and getting over sicknesses my entire life, and it progressively became worse and worse. So maybe that tells us something about when it began. The craziest part about all this, at least to me, is that the presentation of my immunodysfunction is very unique to me. My geneticist said he has never seen another case like this. He said, for all we know, we could call it the Jackie disease because there is no diagnostic name for what I have. All we know is that I have severe immunodysfunction with some very deficient parts and some very hyperactive parts. I also have a metabolic disorder. My geneticist ran an entire metabolic panel on me through blood work and urine. In my specific case, I do not utilize fats the way I should. When your body requires it, you'll burn through sugar and then fat. And my body just does not use fat properly. It's very likely causing some blood sugar issues I've been having. My blood sugar goes unusually low very shortly after eating. For example, I could eat something sugary, something with lots of carbs, something with not many carbs. It doesn't matter what it is. I could eat and then 20 minutes later, 45 minutes later, shortly after that, my blood sugar will drop quickly to the low 70s. Whenever my blood sugar goes below 80, I get a very shaky and unwell feeling. I get dizzy, I get nauseous. Everybody's blood sugar threshold is different, and below 80 just happens to be where mine is for not feeling well. This drop in blood sugar after eating is due to my metabolic disorder, and my gastroparesis contributes to it due to slow digestion and malabsorption. There's no treatment for my metabolic disorder other than treating the symptoms. Thankfully, I have had no technical lows thus far, meaning below 70, but my doctor did say my metabolic disorder could get worse, or it could stay the same. I'm just gonna take it as it comes. Mast cell activation disorder is an immunological condition where the mast cells of the body inappropriately and excessively degranulate, releasing chemical mediators. It results in many chronic symptoms, including flushing, palpitations, headaches, nausea, GI distress, allergy attacks, even anaphylaxis, and so much more. There are a great variety of symptoms that can come from mast cell activation disorder, and each mast cell warrior is affected individually. My type of mast cell activation disorder is mast cell activation syndrome. It's often seen with POTS and EDS, and some people even call them the trifecta or the trinity. My most common symptoms of my mast cell activation syndrome are dizziness, GI issues, flushing, anaphylaxis, shortness of breath, and allergy-related issues. Allergens and stress can trigger this disorder by causing mast cells to degranulate, but they can also degranulate for no reason at all. I have confirmed environmental allergens, and I'm also allergic to cigar and cigarette smoke, so I avoid those at all possible costs. I also avoid high histamine foods to help with this disorder. I underwent a lot of testing to get this diagnosis, one of which was a 24-hour urine collection test. Yes, I had to collect my urine for 24 hours, and the jugs had to be stored in the fridge, but it was worth it because I got some answers. I did that test on 2 separate occasions while following a low histamine diet, and my results still came back with elevated urine histamine levels. That's indicative of mast cell activation syndrome. Also, my blood serum histamine levels came back elevated. I was not on histamine blockers or any other mast cell medications when I did that testing because my doctors said that could alter results. I also had blood tryptase levels taken, and mine were always normal even when it was taken in the middle of an allergy attack or anaphylaxis. Normal tryptase levels does not automatically rule out mast cell activation syndrome, but they're usually elevated for something called systemic mastocytosis. I had a bone marrow biopsy, and that completely ruled out the possibility of systemic mastocytosis for myself. I've had a positive response to mast cell activation syndrome treatment, and that has further helped confirm my diagnosis. I am on histamine blockers, H1 and H2. I do cromulin breathing treatments through my nebulizer, and of course I have an EpiPen for when I go into anaphylaxis. Anaphylaxis can sometimes mimic an angioedema attack, but I'm generally good at telling the difference because it feels different to me and how the swelling of my throat occurs. Also, I don't tend to get the bright red rashes that come with my angioedema attack when I have anaphylaxis. My mast cell activation disorder is due to my severe immunodysfunction, in which I have very hyperactive parts of my immune system and some very deficient parts of my immune system. Mast cells are very closely tied into your immune system, so it makes sense that my mast cells are out of whack because my immune system doesn't function properly either. It's the hyperactive parts of my immune system that are causing my mast cell activation disorder. We are treating my immunodysfunction with IVIG, and it is really hoped that if we improve my immune system with IVIG, we'll also see some relief in my mast cell activation disorder. Well, that's everything. I give you major props if you watch the entire thing. So don't forget, there is a table of contents in the description of this video, so you can skip right to the chronic illness you're interested in. There's also a ton of helpful links in the description. Thank you so much for watching. If you learned even just a little bit about one of my chronic illnesses, I am thrilled because by watching, you are helping me reach my goal of spreading awareness for chronic illnesses and service dogs alike. So thank you, and thank you.